Hi, I'm Dr. Eti Ben-Shabbat from Brain Rehab Academy, and in this video I'll answer a question that I get asked by clients, patients, clinicians, and it's the question of, can the radiologist be wrong? So I thought that whilst we're talking about stroke, it's a good time to address this question, and I'm dedicating the sixth video in my stroke series to answer this question. The reason it's important to discuss this question is because the radiology report is used extensively by the rehab team. It is used to make treatment decisions, and therefore it's important to know when the radiologists are unlikely to make mistakes and when mistakes might happen. By the end of this video, you'll be able to identify in the radiology report the information that is unlikely to contain an error, and you'll also be able to identify the information that may have an error. You will also be able to use a system for cross-checking the radiology report to make sure it doesn't contain errors. Let's start by talking about professions in which making an error can be fatal. If people choose to take that sort of profession, they need to undergo extensive training and extensive examination as well. Take, for example, pilots. Pilots have to undergo extensive training, lots of hours of flying before they can fly an airplane by themselves, lots of testing and simulation because an error could be costly and affect many, many lives. Medical doctors and radiologists fall under the same category, and this is because a mistake in their profession can also be fatal and cost lives. Radiologists are trained and their job is about giving diagnosis. This is a really important job because the diagnosis is what's going to guide the neurologist with regards to what sort of treatment to give the person. So they undergo extensive training and testing with regards to the diagnosis, with regards to giving the correct diagnosis. So it's not often that they make mistake with regards to the diagnosis. Indeed, when you look at the radiology report, you'll see that most of the information in the radiology report is dedicated to either supporting or negating particular diagnoses. What you won't find as much in the radiology report is information about the anatomical structures that are affected. The anatomical information that you will find is likely to be more general than what you would like as a rehabilitation clinician. But you have to understand the context because the exact anatomical location of lesions in the brain don't particularly give you information about the pathology. And if the job of the radiologist is to determine pathology, then the anatomical location is not that important. Therefore, if radiologists make a mistake, it's more likely to be around the area of the specific anatomical location. What does this mean to you as a rehabilitation clinician? It means that except for reading at the radiology report, you also need to look at the brain images. And I suggest 4 steps to guide you in that process. Step number 1 is read the radiology report. Step number 2 is identify the anatomical structures that are affected by the lesion. Step number 3, go to the brain images and identify exactly which structures are affected with higher level of specificity. Now you're going to need that because the specific anatomical structures that are affected will determine the functions that will be affected and therefore which treatments you're going to be delivering. Then if you feel that there is incongruency between what you're seeing clinically and what you're seeing on brain imaging, then go back to the radiologist and have a chat with them or seek a second opinion with regards to the radiology report. If you're brain imaging trained, then you can go through that process yourself. If you're not brain imaging trained, then you might want to seek someone who is brain imaging trained. Or alternatively, you can take brain imaging training and upskill yourself. Now let's see how this plays out in an example. This is an example of a patient that a clinician contacted me about. The patient had recurrent tumors, so recurrent cancer, and the clinician felt that the clinical presentation did not match what was going on in the imaging. So I followed those 4 steps. Step number 1. I looked at the radiology report and I wanted to understand really carefully what's going on with the pathology. Step number 2. I tried to find in the radiology report the information that was related to the anatomical structures. And the information there said that it was the frontal lobe that was affected, which means motor function. I went and had a look at the brain images myself, and then I saw that in fact it wasn't the frontal lobe that was affected, it was the parietal lobe that was affected, which means they're going to have good motor recovery. They have a sensory element that causing them the problematic movements, and therefore I need to address, or the clinician needs to address, the sensory deficits that this person has. The fourth step is about reconciling the clinical presentation, the images, and the report. Now, due to my extensive brain imaging training, I'm quite comfortable chatting with radiologists, so I went and had a chat with a radiologist to figure out how the radiology report, the images, and the clinical presentation fit together. The point to take from this case is that the location of the lesion didn't really change what the pathology was. So it didn't make much of a difference to the radiologist or the neurologist or to the treatment that was given. But it did make a difference to us as rehabilitation clinicians. It did make a difference to the type of approach we were taking. So let's summarize it all. In this video, I talked about the extensive training that radiologists undergo with regards to providing diagnosis. I also explained why this is the reason that radiologists are unlikely to make mistakes with regards to diagnosis. I also explained that in terms of anatomical location, this is of a lower importance to the radiologist, and therefore, if they make a mistake, it might be around the area of anatomical location. This is also the reason that we need to be very familiar with identifying anatomical structures in the brain imaging, because it's of interest to us. Finally, I provided you with a system for cross-checking the radiology report, the information in the radiology report that can help you identify anatomical errors and address them. If you found this video useful, I'll be grateful if you could share it with your colleagues. And please head to my YouTube channel and subscribe and click the like button. If you would like to know more about how to use brain imaging within rehab context, I suggest that you go to my website, have a look there. There's lots of information as well as short and long courses. I will see you in the next video.